The House comes to questions for oral answer. Question number 1, in the name of the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he agree with the comments by the Chief Executive of the Southern District Health Board on Tuesday that, quote, there is clearly an issue with the food, otherwise patients would not be complaining, end quote. If not, why not?
Thank you.
The Honourable Dr Jonathan Coleman.
Mr Speaker, I've spoken with the Chief Executive and I've noted her comments, and I expect that if she feels there's a problem, she will fix it. She tells me that in the recent survey of 153 patients, 75% said the food was okay and 25% wanted improvements. I had a meal there and I'm with the 75%. I also accepted that Southern is delivering over 2,600 more surgical operations than 8 years ago and is steadily turning around a 12-year financial deficit situation.
That's right.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
If his food experience at Dunedin Hospital was, quote, very good, why have complaints over hospital meals prompted the introduction of, quote, patient experience coordinators who will patrol wards during and after each meal service, acting like some sort of Mr Bumble from Oliver Twist?
The Honourable Dr Jonathan Coleman.
I'm not aware of that new appointment. What I do know is that if this is question 1 on a Thursday, we're clearly covering off the big issues pretty well.
Order.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Given 13 DHBs haven't signed up to Compass Hospital food, what are the total revised savings over the 15-year period of the contract, minus the $4 million spent on the business case?
The Honourable Dr Jonathan Coleman.
Speaker, if the member likes to put that down in a written question, I'd be very happy to give her an answer. But what I can say is there are considerable savings that will help fund those 50,000 extra operations a year and 110,000 appointments and make up for the 400 operations that Mrs King cut from Southern DHB.
Order. The last part's not going to help the order of the House. Supplementary question, the Honourable Dr Jonathan Coleman.
Can he... Yes, it's me, Mr Speaker.
The Honourable Annette King.
Thank you, Mr Speaker. I don't look like him, do I? Can he understand the anger of patients at his penny pinching at their expense, leading to families bringing in meals to Dunedin Hospital, something that happens in third world countries?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I don't think the patients are angry. As I say, 75% are happy with the food.
You ready now? Yep.
Supplementary question, Honourable Annette King.
Thank you, Mr Speaker. Mr Speaker, is he relieved that Compass has now removed the muffin and sausage lunch, but should they go further and remove the half a burger bun and runny mince option, or the 1.5 pie option, or the macaroni and mash spread choice for the sake of sick patients' health, Mr Speaker?
The Honourable Dr Jonathan Coleman.
No, Mr Speaker, I'm just relieved that this is the biggest health issue in New Zealand.
Supplementary question, Mr Speaker.
Order.
Is he aware?
Order. I haven't called the member.
Is
the Honourable Annette King.
Is he aware, Mr Speaker, that this is a big issue for patients, that he minimises and laughs at, but they certainly don't? So when he said that I should man up and eat the Dunedin Hospital food, didn't he realise that he was admitting the food was so damn terrible you had to have courage to eat it?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I'm aware that the big issue in Dunedin were the 400 operations that Mrs King cut down there and the 2,600 operations extra that we are doing now compared to when we took over from her disastrous regime.
Order. Question number 2.